I'm Dr. David Bloom with Personal Care Physicians, and many patients will ask me, is there anything really new to help the common cold? Well, yes. Finally, there's a fast and more accurate test using the latest in DNA technology. This is great news as upper respiratory infections are so prevalent. In fact, the third most common presenting symptom to a primary care office is a cough. And each year, kids have up to 5 colds, adults about 2 or 3 per year. This causes plenty of aggravation, wasted time, multiple doctor visits, unnecessary antibiotics, and so on. Certainly some patients do need an antibiotic along with other treatment, but viruses are the most common cause of upper respiratory infections, about 90% of the time. And there is solid research now that antibiotics are not effective in adults or in children. Back to something new to help the diagnosis. It uses DNA testing with polymerase chain reaction, or PCR. It's faster and more comprehensive than other tests. Sure, doctors have had rapid strep tests and influenza tests available for immediate diagnosis, but now we can accurately tell if antibiotics are needed or not. It will look for about 13 other viruses and bacteria besides the strep and the flu. The DNA test was approved by the FDA in 2011, but was used mainly in hospitals back then. Personally, I first came across it when I found it was being used at Chalk and Orange when my daughter was very ill. I'm thrilled that now we use this advanced tool in our office, as it definitely fits with our personalized care model. It also fits well with my belief in precision medicine, which uses evidence-based decisions. I no longer have to make an educated guess as to the cause of an upper respiratory infection. Yes, a guess, because the number of different symptoms doesn't help, nor does the color of one's phlegm. Green or other discolored mucus can be due to a virus or a bacteria. The same for fever, which often prompts calls to the doctor. Instead of just treating the symptoms and following a patient to see how quickly they improve or worsen, I now order the simple nasal swab test. It's sent to a local lab, and results are typically back within 24 hours, and often within just 5 or 6 hours. More and more doctors' offices will likely start using this DNA test soon, and I'm surprised that every urgent care and every ER hasn't done so yet. Of course, this is not inexpensive, but Medicare and many carriers do cover the test fully without even a copay. So next time you or a family member has the onset of cold symptoms, consider asking about the DNA nasal swab test instead of asking for antibiotics, or instead of just assuming it's a virus and then waiting another week to be certain. Of course, don't forget about the importance of staying very well hydrated when you're ill. Plus, frequent hand washing is so important to not only prevent the spread to others, but should also be performed when you're healthy to avoid becoming infected from those who are sick. Thank you and stay well.